Thank you, everyone. So nice to see you all here. Happy Thanksgiving in advance of this week. It's a really special evening for us, actually, at the Hypersomnia Foundation with Kelsey and Emily, who've so kindly and graciously given up their time and expertise to talk about pregnancy and parenting. This is such a complex issue and so challenging. So we're really grateful for their presence. And they will both be doing like kind of mini kind of presentations, and there's lots of opportunities to ask questions. So I hope that's useful to all of you. On the Hypersomnia Foundation side, I just wanted to note that we did a webinar probably 2 weeks ago now, and the videos of that are out on our YouTube channel. So there were some really good sessions there on disability and an overview of what's happening in the sleep space. It's a really exciting and fast-paced time right now for drug development, in particular clinical trials in IH and narcolepsy, of course. So there was an update there. Again, the Hypersomnia Foundation YouTube channel is pretty cool, and there's lots of update information if you missed it. And then the only other thing I have to say, which is always this time of year, as we think about being, like filled with gratitude and grateful for all that we have an annual end of year giving campaign. So I'm going to put a donate button just in the chat. But I do feel kind of on the leadership side that our funding mostly comes from drug developers and private donors, and I really have a hard time giving that information to our patient community because you all the people that we serve. That said, I will just pop a donate button in the chat, but zero pressure. Anyway, okay, Matt, over to you for the really fun stuff.
All right. Thank you, Claire. This is everybody's favorite part of the session is where I get to read through the disclaimer statement. So bear with me. The over-under on mistakes is usually like 2. So our UNIGHT virtual forum is educational and supportive in nature and will offer self-care strategies to help you in your daily life. However, the group will not engage in rendering any psychological or healthcare advice for any particular individual or situation and will not provide medical, mental health, or any other type of health-related service. No diagnosis, treatment recommendations, medication advice, or any other type of medical or mental health recommendations will be offered. Our support group is not a substitute for or alternative to treatment by a licensed medical professional. Always seek the advice of your own physician or another qualified health provider with any questions you may have regarding your medical condition. The Hypersomnia Foundation does not recommend or endorse any specific tests, physicians, lawyers, legal advisors, products, medications, procedures, opinions, or other information that may be referenced on its website or during any online support groups. So with that out of the way, it is my pleasure to introduce Kelsey and Emily. I'm going to go ahead and read through their bios before we get started. So Kelsey Biddle, MD, lives in Boston, Massachusetts, and is currently in her first year of psychiatric residency at Brigham and Women's Hospital. She was diagnosed with narcolepsy type 1 at age 22 and has performed research on the social impact of narcolepsy and on navigating pregnancy with narcolepsy. Kelsey was a Wake Up Narcolepsy board member from 2019 to 2025 and a support group facilitator from 2004 to 2025. She is passionate about supporting individuals with chronic illness across the lifespan and is currently working to advocate for more research to guide decision making for managing narcolepsy during pregnancy and postpartum. Outside of work, Kelsey enjoys spending time outdoors with her friends, family, and her husband, especially hiking and exploring new ice cream shops across New England. Emily Baker, PhD, lives in Ohio and is the mom of 3 sons, age 14, 13, and 8. She is a scientist and medical writer who was diagnosed with narcolepsy type 1 at age 20 and who has performed research and medication use during lactation. Emily has been a Wake Up Narcolepsy support group facilitator since 2018 and co-leads the Thursdays Pregnancy and Parenting Group. She is working to advocate for more research and to guide decision-making for managing narcolepsy during pregnancy and postpartum. Emily enjoys being active and especially playing various sports with her family. So that's the kind of formal introduction. I just want to say that Kelsey and Emily have both been tremendous influences on me as an advocate author. They are phenomenal resources for the entire community, bridging the advocate voice and the medical voice. So it's truly a pleasure to introduce both Kelsey and Emily tonight, and look forward to hearing the conversation. For those in the audience, please kind of keep yourself muted. There will be a Q&A between each individual session, and we look forward to answering those questions as they come along. So I will pass the torch to you guys.
Thanks so much, Matt. And hi everyone, I'm Kelsey. Me and Emily are going to be sort of tag teaming this presentation. I'm going to spend about 15 minutes. I did not time myself, so we'll see how that goes. Talking a little bit more about the research side of things in terms of pregnancy. And then Emily will sort of pick things up, focusing a little bit more on the support group side of things. And we'll both hopefully have a little bit of time after we chat for Q&A if any questions come up. So without further ado, I will share my slides. Can everyone see my slides? Yes? Okay, great. So as Matt mentioned, I'm going to be chatting a little bit about navigating pregnancy with narcolepsy slash hypersomnias. I know Matt already introduced me so well, but a little bit about me. I currently live in Boston with my husband, Bridget. This is from our wedding in May. Love spending time outdoors. And as of around 5 months ago, I'm officially a doctor, which is crazy. Still feels quite surreal. A little bit about my interest in narcolepsy and pregnancy. So selfishly, I've thought about this topic more peripherally because someday I hope to become a parent with narcolepsy and a pregnant person with narcolepsy, but have not myself started that journey. However, my kind of OG PWN bestie, Jenna, pictured here, about 2 years ago, started her own narcolepsy and pregnancy journey. And I kind of followed along with her. And one of the first conversations she had with her narcolepsy doctor, kind of about how to manage her narcolepsy during pregnancy. His suggestion was, well, we don't actually have any medications that have been proven safe and effective during pregnancy. So the best advice I can give you is to essentially stop taking all of your medications. And that just didn't sit well with either of us. It really didn't sit well with me as somebody who went into medicine to really try to help people live their best lives with their chronic illnesses. And the idea, just thinking about myself someday, like cold turkey going off all my meds, just didn't love that. And now Jenna has a beautiful baby boy, Hugh. That's the three of us. He was probably, I don't know, like 6 to 8 months then. And then on the far right, that was Jenna and Hugh at my wedding in the spring. So that's where my interest in this topic started and wanted to chat a little bit today, kind of on some of the challenges around narcolepsy during pregnancy, the sort of reason it's important to really study this. And then I have been working on a research project for the last year and a half or so, and I'll share some kind of preview findings from that research project that we're currently writing up in the hopes that we'll publish that at some point early next year. So, this is not going to be news to anyone, but narcolepsy affects people of childbearing potential. Some true things about narcolepsy. The typical age of onset is in teens and early 20s. It's equally common in women and men, and it is a chronic illness that requires lifelong symptomatic treatment. Um, some facts about pregnancy. The average age of first birth in the US is around 27 years old, according to the CDC in 2021. And there's a lot of physiologic changes that can happen during pregnancy that can impact underlying conditions and vice versa. So, chronic conditions that people have can impact the pregnancy experience. The challenge right now is, we know women with narcolepsy will experience pregnancy. However, very little is known about how narcolepsy symptoms evolve during pregnancy, and there really is no consensus on an optimal treatment approach during pregnancy. A little history that I kind of did a deep dive in, sort of as part of my newfound interest in pregnancy about research and sort of the context for why we know so little about medication and sort of chronic illnesses during pregnancy is for much of history, pregnant women have been considered a protected group and thus excluded from research. And this really dates back to the 1950s when a medication called the thalidomide, unfortunately, it was never approved in the US, but sort of worldwide, it was prescribed to women who were pregnant. Who were experiencing morning sickness, and it caused very severe birth defects. And sort of as a response to this, understandably, the scientific community had the motivation to really try to keep this from happening again in the future. And so from the 1960s to the early 1990s, all women of childbearing age, regardless of whether they were pregnant or not, were excluded from clinical trials with the goal of avoiding potential risks to the fetus. In the early 1990s, a act was passed called the NIH Revitalization Act that mandated the inclusion of women and minorities in NIH research. However, pregnant women remained excluded. And just to highlight here, women and minorities were excluded from just about all research up until the mid 1990s. So if you think about, everything we know about physiology and drug development, most of that knowledge comes from exclusively studying populations of men prior to the 1990s, which is kind of wild to think about. In 2014, the FDA sort of published a new rule called the Pregnancy and Lactation Labeling Rule that said product labels must include information on use during pregnancy and lactation. Of course, that's difficult when this isn't an area that has really been studied. And then in 2016, sort of in light of that problem, a task force was established, sort of focusing on pregnant and lactating women to try to support research on both safe and effective therapies for pregnant and lactating women. Another issue is that there has been very limited animal and human data. So most guidelines on medication use during pregnancy are really based on very, very small animal studies that are conducted by drug companies during drug development. And there are very few studies thus far that have explored symptom trajectory during pregnancy for narcolepsy specifically. And there's also been very limited human data from pregnancy registries. So in the sort of narcolepsy space, there's a couple registries that have been established for pitolisant, solriamfetol, and modafinil. And for modafinil, for example, we've actually learned that there is some teratogenicity associated with modafinil. And so now we have data that supports no sort of stopping that medication during pregnancy. It's one of the few medications that we actually do have data on. However, there's no registry or really any human data for any of the sodium oxybate medications. And sort of in light of that, the prescribing information can seem really contradictory. So, for example, some snippets from Xyrem's prescribing information, if you look through the FDA prescribing information, it will say, based on animal data, may cause fetal harm. However, when you look elsewhere in the Xyrem prescribing information, it says there's no adequate and well-controlled studies in pregnant women to establish the safe use. And therefore, you should only be used during pregnancy if the potential benefit outweighs the potential risk to the fetus. Of course, how does one decide that benefit if there really is no data to base that decision off of? And then if you go to drugs.com, it says use is not recommended. And again, this is not really based on any research beyond a very, very small animal study that was done in the drug development process for oxybates. Another challenge is sort of in light of the lack of research, there really aren't any evidence-based guidelines. And this really makes it hard to engage in shared decision making with your provider. Instead, there ends up being a reliance on anecdotal evidence and individual experiences, which can be helpful, but it can still make the decision really challenging and lead to a lot of uncertainty, frustration, anxiety, and guilt around making that decision. It's also really hard to weigh the potential risk benefit when you don't have data to base those decisions off of, and sort of the balance between the, you know, treating a mom's chronic illness and avoiding harm to fetus. Often there ends up being sort of this skewed perspective to really focus on avoiding harm to fetus and not as much emphasis on the fact that there is actually potential harm associated with not adequately treating a mom's chronic illness and the impact that that could have both on the mother and the fetus. And in narcolepsy, there haven't yet really been any studies that have explored the health risks of untreated narcolepsy in the context of pregnancy. Um, to date, there have been three studies looking at narcolepsy in pregnancy, one in 2010, one in 2013, and one in 2019. And I'll sort of briefly share some of the findings from those studies. One was a sort of retrospective study in Europe, and there was quite a gap between pregnancy and survey responses. And primarily, its focus was on pregnancy complications rather than narcolepsy symptoms. And it compared people who developed symptoms before versus after pregnancy. And they did find a slightly higher rate of non-severe pregnancy complications in people that had narcolepsy before, including things like weight gain, impaired glucose metabolism, and anemia. And in terms of narcolepsy symptoms studied, cataplexy and sleep attacks were the only symptoms that were they collected data on in this study. And then one thing to note, the rate of medication use in this study was quite low. Only about 1 in 10 folks in the study continued medications during pregnancy. And that number was even lower in narcolepsy type 2 compared to narcolepsy type 1. In 2013, there was a study sort of polling physician practices, and some of the highlights include that 50% of narcolepsy specialists recommended stopping medications throughout the entire pregnancy, and over 60% of narcolepsy specialists recommended stopping meds while breastfeeding. And there was no patient data included in this study. And as part of the lit review that they did for the study, one of the conclusions was that the risk for teratogenic effects from narcolepsy medications and therapeutic doses are actually quite low, and based on current data may be essentially non-existent. And their conclusion was that the perceived risks of taking narcolepsy medication during pregnancy are often overestimated by physicians. Finally, there was a Narcolepsy Network study conducted in 2019, detailing 57 pregnancies, asking questions about things like medication use, physician counseling about contraception in pregnancy, pregnancy history and outcomes, but not really much about symptoms. There we go. Similar to the European survey, there was a pretty low rate of medication continuation during pregnancy. So 80% of people did not use any medication during their pregnancy. And the predominant sort of reason for discontinuing medications was fear of harming the fetus, or being advised by their physician to stop. So now I'll sort of share very briefly a preview of the research that I've been working on. And the goal of this research was really to try to at least start to fill this really critical knowledge gap on the evidence-based management of narcolepsy during pregnancy. And I've had lots of help from these collaborators listed below. And some of the things we were sort of trying to focus on in light of prior surveys that didn't sort of limit the time since pregnancy, which can, of course, memory sometimes, changes over time. We really tried to focus on more recent pregnancies and limited our respondents to people who'd had pregnancies within the last 2 years. Um, we also tried to explore narcolepsy symptoms, sort of more specifically, and used validated measures like the Narcolepsy Severity Scale to do so. And our long-term goal, after we publish these findings, is to sort of take what we learn and use it to design a more prospective study. So rather than sort of asking people questions after the fact, really sort of have some sort of active study ongoing that people could participate in when they, start thinking about starting their pregnancy journey or are pregnant. So a very brief preview of some of our data based on 32 respondents. We, as mentioned, sort of asked people to complete the narcolepsy severity scale at different points. Of course, with the caveat that this is, all retrospective data. But as you can see, people reported scores before pregnancy, that were substantially lower and then slightly higher severity scores during pregnancy. But one thing to highlight is that actually the most severe symptoms were in the 6 weeks postpartum. Additionally, there were sort of very different experiences, a lot of variety in terms of whether people reported that their symptoms were better, worse, or the same compared to their pre-pregnancy symptoms, which suggests, there really is not a like one size fits all experience that people are having. Some people are actually finding that their symptoms feel better during pregnancy. Some people find that they feel worse, and some people it feels very similar. Um, and sort of again, looking at the 6 weeks postpartum, there are slightly more people that are saying their symptoms are worse or about the same compared to better during this phase. So that's definitely, as people might suspect, a challenging period. Um, Finally, one of the findings I wanted to highlight, we asked people to comment on the symptoms that they were sort of worried about going into pregnancy and then what they actually found most bothersome during pregnancy. And one of the things we noticed was that disrupted sleep was a particularly bothersome symptom that a lot of people were worried about before pregnancy, but it actually was sort of listed as the most bothersome symptom of our cohort. Um, that was just a very brief preview. Lots more to come once we've sort of sorted through all the data and I have more time on my hands. But happy to answer any questions from folks. And sorry if I went a little bit over.
No, no, you're fine. That was a very thorough presentation. I did want to ask anybody who has a question if they would just use a hand raise feature, or if they want to put a question in the chat, that would be fantastic, just to make sure I know who to call on. I did have one to kickstart conversation. I know this you were talking a lot about the narcolepsy specific questions, but I just wanted to kind of draw attention to the fact that a lot of these same medications or have direct application for IH as well. And so just wanted to kind of do a level set there that the medication questions, definitely have direct impact on IH there as well. So Emily, I'm going to toss it to you for your presentation.
Hello. It's so good to be with everybody. I love the narcolepsy community. I don't even know you, but I'm like, my family, we're together. Um, so perhaps I've encountered some of you at different conferences, etc. But I do just admire the work that Claire and Matt are involved in, and um, yeah, they're just some really phenomenal people working to advocate for research and knowledge and community and support and it's really inspiring to be a part of it. So I'm happy to be here tonight and just wanted to kind of like look at faces before I pull up my presentation. Sometimes this format, you just feel like you're kind of like talking into the ether, but it's I'm going to assume that folks here are regulars, and so you happen to be here tonight when we're talking about pregnancy, but I'll assume some of you are here because you're interested in the topic, because you have loved ones who have had this experience or embarking on this experience, or you yourselves are have been there, done that, like myself, or are considering that journey and what it looks like. So I like want to put exclamation points on all of Kelsey's slides because I have been that patient, just confused and unsure and not wanting to pose risk to an unborn child, but wondering how I'm going to drive to work unmedicated, how I'm going to keep my job unmedicated. And so it's a really fraught time. And a lot of us, I was diagnosed when I was 20 years old and got married like a year and a half later. And, it was just like embracing this new diagnosis at the time that we wanted and had all these questions because I just, found a drug that actually helped me be functional. And uh, so it means a lot to feel like I'm at least sharing from my experience and offering support to this community. And I am, like finding a lot of fulfillment in family life as a mom with narcolepsy. And I will confess, like, because I'll show you some pictures and I like look back to having infants and I'm like, man, I'm glad I don't have infants anymore because it was really hard. And I give myself more grace looking back than I did then. Um, but I I don't think I recognized how how much my sleepiness and uh, my condition was contributing to my experience, and I love being a mom, but I like being a mom of kids who can take care of themselves better than babies can take care of themselves. Um, so that's a big one for parents with narcolepsy to have grace with themselves. So I'm going to try this. My slides are in like a Google um, slideshow. You should never like try things for the first time when you're leading a webinar, but we're in this together. So sharing my screen, desktop 2 over here. Is it working?
Works great.
Yes. Okay, good luck tonight. Okay, so just a little introduction of myself. My name's Emily Clegg Barker. I grew up in the Salt Lake City area, and now I live in beautiful Cleveland. Um, Matt mentioned in my intro that I enjoy sports and outdoors, music. My background is in science, and I currently work as a medical writer. Um, my undergrad and grad degrees are in chemistry, and I've been able to do some research related to narcolepsy meds in lactation. I'll share a little bit about that. Was diagnosed when I was 20 years old. Here's my wonderful husband and support who, takes care of the family while I do things like this in the evening. Um, Sam, and we have 3 sons. This is like a way outdated picture, but like I said, it brings back memories because now my oldest is 14, my middle son is 13, and my youngest is 8. So that's just wild because we were, back here. Um, this is still very typical though, selfies with my sons trailing me on their bicycles. So tonight I'll talk a little bit about what I do as a co-facilitator of the P&P, Pregnancy and Parenting with Narcolepsy group. That's with Wake Up Narcolepsy. as well as some of the advocating efforts that I've been involved in. A lot of the recent efforts have been between Kelsey and myself, and it's so great to work with a team because it's so motivating. Just to increase the attention to some of these research gaps that Kelsey highlighted, and hoping for more studies that can better support informed decision making. But alongside that, just I, am a greater witness than I was years ago of the value of having peer support, aside from being able to make these difficult decisions. Being able to meet people who are going through this experience and share it with them is so empowering. And that's what we do through this peer support group at Wake Up Narcolepsy, Pregnancy and Parenting. So I'm going to share a little information on it, and I'll just start here. So you have some of the information if you have interest or wanted to refer people who might benefit. We work with heypeers.com, which Hey Peers offers peer support in all sorts of mental health states, chronic illness, all sorts of areas, and it's free. And they're we as people with narcolepsy moderate the meetings, but there are like professionals there as well who work for Hey Peers, and to that are like licensed social workers and support us. And so they're really professionally done. Our environment is very positive and supportive, and at the same time, vulnerable and real, where you feel like you can share your challenges, but come out with some hopeful ideas. So our schedule, we have like 3 co-facilitators who take turns during the 6 weeks, and I'll show you what those 6 weeks cover. We kind of go in order from preconception all the way to having children and beyond. So I'll walk through those, and then we take a 3-week break, and we jump back on for 6 weeks. And there's like no commitment. You don't have to feel like you have to come for the 6 weeks if you join. And we've been going, since like 2018. It was really fun to be on here with Claire, because that's like where I kind of started in my involvement in this community. And I was connected with Claire, and we were like, how can we support this population? And she had like just kind of started thinking about these peer support things. And it was like pre-COVID, so nobody was really thinking about like online support groups. So I think she was really inspirational, and it's been great to continue to be a part of it. And they still accept me, even though like I'm beyond the the baby stage, but I feel like I have something important to offer as a parent with narcolepsy. And it's usually a pretty intimate small group. I think we've held on to, we have like an email list that probably has like 120 people who have been in the group and attended regularly at some point. But week to week, the group is seldom more than 5 to 10. And because I think people kind of come and get what they want or need, or they have their babies. And I mean, it's like super busy to be a mom with narcolepsy and a baby. And so people often move on and sometimes come back. But we have like a lot of regular new people. And I would say a big portion of those attending are preconception. They're kind of like, can I do this? What does this look like? And they get on and they're like 3 pregnant women, and they're like, oh, people are doing this. So it's often very helpful. And so, like I mentioned, we go in like these 6-week stints, and this is just to give it some structure. Week to week, we really prioritize what the people attending need the most. But we kind of have like these backup topics to get things rolling if people are just kind of there for learning in addition to support. And so when we come back, it's just kind of open and welcome back and giving updates. And then we dive in again, starting at before the baby. Um, and so I'm kind of presenting these with the hope that you who are listening, if like some of these um, pique your interest or you want to ask questions, like what do conversations about this look like? And I can kind of share some of the insights that have come out over the years on these different topics. So I will just walk through them now and want you guys to be thinking if there's anything you would like to have more information about, just like what I hear as I engage with this population. So narcolepsy before the baby, we talk about uh, prenatal consultations, uh, birth control. Some of the birth control can interact with some of the narcolepsy medications and medication during preconception, because this is really tricky. It can take a year or more to conceive. And so for a person with narcolepsy to be told you should come off your meds during conception, you're like, what? Like, I thought it was going to be 9 months off of my meds. You're telling me it's potentially 9 plus 12 months off of my meds? Like, and so just talking through that with a clinician. Um, and then we go into the role of partner and other support. So here we talk about identifying the people who can be a support for you on this journey, family, friends, partner, therapists, etc. And this is often where we get into this more sensitive conversation about having narcolepsy and being in an intimate relationship. And, the obvious but unspoken impact of like being super tired and often being on sedatives and trying to have an intimate life, good luck like enjoying spontaneity if you take a medication that you go to sleep after 15 minutes on. So that can be a time where people are able to open up and talk about something that is really hard to get very many people to relate to. Week 4, narcolepsy in pregnancy. This is like the bread and butter. Like, this is why people come, because they're like, what am I going to do during pregnancy if I go off of my meds? And so we're not physicians, and we don't try to be. I have enough background in research that we have a disclaimer about, we're not here to offer medical advice, but we, try to keep things scientific where there is an understanding. And so relying on some of the academic resources that Kelsey presented to inform each other on what is known about medications in pregnancy. And then I'm also going to share some resources that might get to some of the questions that were posed by our friend in Australia, because actually Hypersomnia Foundation has like one of the best resource pages on hypersomnia and pregnancy. And so medications in pregnancy, symptom management. So we do talk a lot. And another thing about our group is, like, we're there to support each other in whatever you choose. There are plenty who personally feel strongly about being off of their meds for their pregnancy, or or simply can't because of like, needing to get insurance for the family or keep a job. And then there's also a mix of people who choose to like go off during the more vulnerable portions of pregnancy and then go on like a low dose. So there's such a mix, and we're there to support each other in whatever your journey looks like. And most likely it involves a change in your symptoms, whether you're on meds or not on meds, and what coping strategies there are to manage those symptoms when your meds are reduced. And then we talk about things like work accommodations, like temporary disability or whatever is needed or could be pursued to help you survive difficult time. And then we move into narcolepsy with a newborn, and we talk about, and I say narcolepsy, and I should have made this more inclusive, and I apologize because we do have plenty of IH folks who join us and are more than welcome. And of course, like we're taking so many of the same meds and having so much of the same experience. So we talk about labor and delivery, and similarly, it's kind of like across the map. Like I fortunately had no, and I will mention I'm like so happy to talk about my experiences if you want to ask questions about my personal experiences with pregnancy and narcolepsy. But fortunately, like I didn't know if my cataplexy would be impacted by labor and delivery, but it was not. There are some individuals who like having that as a concern have like had a scheduled C-section to avoid the issue altogether. And so we talk about those kind of things about how labor and delivery could be impacted by your symptoms. And similarly, like for people who are staying on their meds on oxybates, we talk through like, okay, like if you're within 2 weeks of having your baby, nobody really wants to take oxybate like within a few hours of going into labor. And so it's like deciding when to stop your oxybate so that you're not sedated when you should be in timing contractions. So topics like that. And then yeah, sleep deprivation, obviously, for any new mom, but then a new mom with narcolepsy potentially on reduced medication, and then safety for the mom and the baby. And cataplexy is a big topic there, but also sleepiness. The journey of narcolepsy in parenthood, and this is where we kind of like look ahead and talk about the guilt that one can feel as I think any parent with a chronic illness that feels like they're not meeting their children's needs because of the limitations that they have. And that's actually always a really beautiful conversation because I think we always come around to realizing the gift that we give our children because they observe their parents in a struggle. And that's been really fulfilling to watch as my children age. Balancing parenting and career with a hypersomnia disorder, and talking to your children about narcolepsy. That's kind of been interesting to like decide when is a good time to talk about your sleep disorder, when is a good time to talk about the medications that you take and how they impact you without like scaring your children. So those are important conversations, and there's some nice resources out there to help some of these conversations. Okay, and so the other side of, like I mentioned, Kelsey and I both are kind of presently working as as Kelsey is like in her intern year as a resident. I'm also like working and continuing to be a sleepy mom, but we hobble along in continuing to work to advocate for more research and informed decision making. As I mentioned, there's a continued gap for understanding medication safety in pregnancy and during lactation. I had the opportunity before my third son was born to perform some research in emission of oxybates in breast milk. And that was super helpful because we were able to show that kind of like in the bloodstream, the oxybates don't stick around for more than like 5 hours. And so that helped me go back on my meds during lactation after my third son. And this is like a huge topic too in our groups. Like everyone wants to know, like, will I be able to go back on my Xyrem or Xywav? And can I breastfeed? Can I breastfeed while I do it? And so that has been a way that I feel like I've been able to give back in being involved in that research. And then we're continually trying to inform on the existing pregnancy exposure registries. So Kelsey mentioned the three that have existed for medications with a narcolepsy indication. That's Nuvigil, Provigil, which is I don't think you can register for that anymore, but Sunosi and WakeX are open studies. And so I share these in case there are people here who realize they would be eligible for these studies, or somebody who would be eligible. Somebody asked a question, I think it was Katie, wanting to be involved in Kelsey's research project or registry study once it becomes available. And I think we do have a community who want to contribute to research. And so we've made some connections to provide that kind of opportunity. So I'm just going to show these Sunosi. So these are pretty straightforward to register for, and you don't have to be on Sunosi to register for these either, or WakeX. So those exist, and then we're forming a collaboration with some experts her picture was down here, at UCSD, who look more at this is Dr. Tina Chambers. They look more at different health conditions and all sorts of medications in pregnancy. And they don't yet have a health condition for narcolepsy, but we're piloting that if we have individuals in our community who would sign up to have their pregnancy followed and being on a medication during pregnancy. Okay, and then Kelsey already touched on the lack of a registry for the oxybates. So that's another area that we're working to, another gap we're hoping to fill by advocating for more research. Okay, I'm not going to put this in presentation mode because I want to go to these websites. So Hypersomnia Foundation, they always have, for years, they have had a really strong and well-vetted website for pregnancy with a hypersomnia disorder. And so I refer you there if you haven't been there and you have questions. And it's updated since I had seen it prior to yesterday, and is just rife with so much helpful information. Preparing for parenting, preparing for pregnancy, during your pregnancy. So I wanted to point out for the individual who had the question about, is my medication safe to take during pregnancy? So for detailed information, visit the section on our webpage for doctors about pregnancy risk profiles of common hypersomnia medicines. And so I wanted to show you where this is. So you mentioned dextroamphetamine. And so there's all this data so that you can understand and conclusions about, because a lot of these drugs have been around for a long time and used in multiple conditions, and they have some decent information on them. And so I totally recommend this as a resource. And so there's one geared towards patients and there's one geared towards clinicians, and they both are super helpful. To learn about other people's experiences, this is a really long-standing Facebook group called Pregnant People with Narcolepsy and Mothers. And you do have to request to join. And I just find it helpful. If there's a topic I want to know about, I just search and it shows me every time there's been a conversation about that. And Project Sleep, I was involved in a nerd alert that they did on pregnancy and narcolepsy, and they have a great toolkit. So that's what I have. Happy to answer questions, and hopefully this is helpful information to the group.
Thank you so much, Emily. I just want to kind of highlight how cool it is to see advocate-driven research. I mean, obviously you've got a PhD as well, but just the importance of people with the lived experience kind of directing a research project like your work on lactation and oxybates. It was, well, doesn't have direct impact on me. Just the whole idea of you putting that together and providing a resource is one of the driving forces behind me wanting to get more involved in terms of research and putting my mind towards that. So just huge congrats to you for that effort. I can't give you enough compliments for what that's meant to me personally, just in terms of a role model in that regard. So, but I just wanted to just give Kelsey and Emily just a huge thanks for coming on and giving graciously of their time and energy and bandwidth and spoons tonight. I know how much it means to the community to hear from you guys on this topic, and definitely just so much gratitude for both of you, both for the work that you've done tonight for us, but also the work that you continue to do to help elevate our understanding.
Complete pleasure to be here. Thanks for
Awesome.
the opportunity.
Same here.